Critical limb ischemia risk factors consist of age, hypertension, smoking, dyslipidemia, obesity, sedentary lifestyle, family history of atherosclerosis or claudication and diabetes. Standard intervention for CLI may include modifying the risk factors, wound debridement, revascularization, and amputation as the last option. CLI is often seen among diabetics, and in 2019, there were about 463 million worldwide. Diabetes leads to vascular complications like peripheral artery disease or PAD. PAD affects about 19% of diabetics, which progresses towards CLI. This converts to about 88 million poor souls at risk of limb amputation. The concept of photobiomodulation to increase cell metabolism and repair has been studied for some time. In fact, there were several reports on the use of the technology for wound healing among diabetics, but none on its effect on preventing limb amputation. In the past 17 years, and among 1,446 diabetic patients, we were able to include 123 subjects with CLI that were advised major leg amputation. The youngest was 23 and the oldest was 95 years old. 91 subjects completed the treatment while 32 were non-compliant. The subjects were followed up for 6 months to determine the endpoint of amputation or death. Among the compliant group, 79 subjects did not undergo major amputation, while no one avoided a major amputation in the non-compliant group. 12 among the compliant group had major amputation, while all in the non-compliant group had a major amputation or died. The compliant group underwent 15 to 45 PBM exposures, while the non-compliant subjects are those who had less than 3 interventions. Observations. In the limb loss cases, a knee-level surgery was done. There was extensive bone involvement. Sepsis played a factor, and there were comorbid diseases like CKD, heart failure, and COPD. In the limb salvage cases, a knee-level amputation was prevented, and sometimes we salvaged the whole limb. In conclusion, completed adjunct photobiomodulation in critical limb ischemia subjects prevented a knee-level amputation or death in this case series. This implies that adjunct PBM has the potential to prevent major limb amputations for millions of our diabetic fellow men. Thank you.